Have you ever found yourself staring at a medicine cabinet, wondering if there's another way to tackle depression, one that doesn't involve a daily routine of pills? Maybe you've heard stories of people managing their mental health without medication, or perhaps you're simply curious about what other options exist. In a city as vibrant and diverse as London, where life moves fast and expectations can feel overwhelming, it's natural to seek solutions that fit your unique needs and lifestyle. Today, let's explore the real evidence-based alternatives to medication for depression, options that are available right here in London, and that might just change your life. First and foremost, it's important to remember that you're not alone in this journey. Depression affects millions of people across the UK from all walks of life. Whether you're a student, a parent, a professional, or retired, mental health challenges don't discriminate, and there's absolutely no shame in reaching out for help. In fact, seeking support is a sign of strength, not weakness. London is home to countless support groups, compassionate therapists, and understanding communities ready to walk alongside you. Depression is incredibly common, but it's also deeply personal. It doesn't look the same for everyone. For some, it's a persistent feeling of sadness that lingers like a grey London sky. For others, it's a sense of emptiness, a lack of motivation, or a struggle to find joy in things that once brought happiness. You might notice changes in your sleep, appetite, or energy levels, or perhaps you find yourself withdrawing from friends and family, feeling isolated even in a crowd. The truth is, depression wears many faces, and each person's experience is valid. Some people feel constantly low, as if a heavy weight is pressing down on them day after day. This persistent sadness can make even the simplest tasks, like getting out of bed or making breakfast, feel overwhelming. It's not just about feeling sad, it's about feeling stuck, unable to shake off the gloom no matter how hard you try. Others struggle to enjoy anything at all. Activities that once sparked excitement or relaxation, meeting friends for coffee, pursuing a favorite hobby, or even just watching a beloved TV show, suddenly feel meaningless. This loss of interest, known as anhedonia, is a hallmark of depression and can make life feel colorless and flat. The severity of depression matters when considering treatment options. Mild depression can often improve with non-medication approaches, especially when caught early and addressed proactively. However, moderate to severe depression may require more intensive support, and sometimes medication is a necessary part of recovery. The key is to find the right combination of strategies that work for you, and to remember that help is available at every step. So what actually works beyond medication? Let's break down the most effective, research-backed options available in London and beyond. One of the most well-established treatments for depression is talking therapy, particularly cognitive behavioral therapy, or CBT. CBT is a structured, goal-oriented form of therapy that helps you identify and challenge negative thought patterns. It's about understanding how your thoughts, feelings, and behaviors are interconnected, and learning practical skills to break the cycle of depression. In London, CBT is widely available through the NHS, private clinics, and community organisations. Many therapists offer both in-person and online sessions, making it easier than ever to access support. During CBT, you'll work with a trained therapist to spot unhelpful thinking habits like catastrophizing, black and white thinking, or self-criticism, and gently challenge them. You might keep a thought diary, practice reframing negative beliefs, or set small, achievable goals. Over time, these skills can help you build resilience, boost your mood, and regain a sense of control over your life. Another proven approach is behavioral activation. This technique focuses on building small, positive routines into your day, even when motivation is low. It's about taking action, however small, to create a sense of achievement and pleasure. For example, making your bed, going for a short walk, or preparing a simple meal can all be steps toward breaking the cycle of inactivity and low mood. Over time, these small victories add up, helping to lift your spirits and restore a sense of purpose. For some people, technology can be a valuable ally in managing depression. There are a growing number of mental health apps and online therapy platforms designed to provide support, guidance, and connection. Whether it's guided meditation, mood tracking, or virtual therapy sessions, these tools can make it easier to access help from the comfort of your own home. In a bustling city like London, where time and travel can be barriers, digital solutions offer flexibility and convenience. Another innovative non-medication treatment is rTMS, repetitive transcranial magnetic stimulation. This cutting-edge therapy uses gentle magnetic pulses to stimulate specific areas of the brain involved in mood regulation. rTMS is non-invasive, meaning there are no needles or surgery involved, and it's generally well tolerated with minimal side effects. It's particularly helpful for people who haven't found relief with traditional therapies or who prefer to avoid medication. Here in London, BritMed offers rTMS as a non-medication option for depression. Their experienced team provides personalized care in a welcoming environment, guiding you through each step of the process. If you're curious about whether rTMS might be right for you, BritMed's clinicians are happy to answer your questions and discuss your options. But let's not forget the basics. Simple lifestyle changes can have a powerful impact on your mental health. Regular exercise, for example, has been shown to boost mood, reduce anxiety, and improve sleep. You don't have to run marathons. Even a brisk walk in one of London's many parks can make a difference. Physical activity releases endorphins, the body's natural feel-good chemicals, and helps regulate stress hormones. Good sleep is another cornerstone of mental well-being. Depression often disrupts sleep patterns, leading to insomnia or oversleeping. Establishing a consistent bedtime routine, limiting screen time before bed, and creating a calm, comfortable sleep environment can all help improve the quality of your rest. Remember, it's not just about the number of hours you sleep, but the quality of that sleep. Social connection is equally important. Spending time with friends, family, or supportive communities can help combat the isolation that often accompanies depression. Even small interactions, a chat with a neighbor, a phone call with a loved one, or joining a local group can lift your mood and remind you that you're not alone. London is full of opportunities to connect, from community centres to hobby clubs to volunteer organisations. For many people, especially during the long, grey British winters, light therapy can be a game changer. Exposure to bright light, particularly in the morning, helps regulate your body's natural rhythms and can alleviate symptoms of seasonal affective disorder, SAD. Light therapy lamps are widely available and easy to use at home. Just 20-30 minutes a day can make a noticeable difference in your energy and mood. It's important to acknowledge that sometimes medication is necessary, especially for moderate to severe depression. Antidepressants can help correct chemical imbalances in the brain and provide relief when other treatments haven't been effective. If your doctor recommends medication, it's not a sign of failure. Rather, it's one of many tools available to support your recovery. The decision to use medication is personal, and it's okay to explore all your options with your healthcare provider. There's no shame in using every tool available to you, whether it's therapy, medication, lifestyle changes, or a combination of approaches. What matters most is finding what works for you. Recovery is not a one-size-fits-all journey, and it's perfectly normal to try different strategies along the way. In fact, research shows that the best results often come from combining approaches. For example, therapy and medication together can be more effective than either one alone. Adding regular exercise, healthy eating, and social connection to the mix can further enhance your well-being. Think of it as building a personalized toolkit for mental health, one that you can draw on whenever you need support. If you're curious about rTMS, interested in therapy, or simply need someone to listen, BritMed is here to help. Their team of compassionate professionals understands the challenges of depression and is dedicated to providing holistic, patient-centered care. Whether you're just starting your journey or looking for new options, you don't have to face depression alone. Taking the first step can feel daunting, but it's also the most important. Reaching out for help, trying a new therapy, or making a small change in your routine can set you on the path to recovery. Your future self will thank you for the courage and determination you showed today. Remember, healing is possible, and brighter days are ahead. Let's recap the key points. Depression is common, but it's also treatable. You have a range of options beyond medication, including talking therapies like CBT, behavioral activation, technology-based support, rTMS, lifestyle changes, and light therapy. Social connection, regular exercise, and good sleep are powerful allies in your recovery. And if you need medication, that's okay too. There's no single right way to heal. If you're in London and looking for support, know that resources are available. The NHS offers free talking therapies, and many private clinics provide specialized care. Community groups, helplines, and online platforms can connect you with others who understand what you're going through. BritMed is one such resource, offering innovative treatments like rTMS alongside traditional therapies. Above all, be gentle with yourself. Recovery takes time, and setbacks are a normal part of the process. Celebrate your progress, no matter how small, and don't hesitate to ask for help when you need it. You deserve support, understanding, and hope. If you're ready to explore your options, reach out to a mental health professional, talk to your GP, or contact BritMed for more information. Your journey to better mental health starts with a single step, and you don't have to walk it alone. Thank you for watching. Remember, depression is treatable, and there are real solutions that work right here in London and beyond. Take care of yourself and take that first step toward a brighter future today.